All right, we're back from the break, and I had this thought about what we were going to talk about, but anyway, I lost that thought. So now we have Amy on the phone. Amy.
Hi, Dr. Reiner. I was listening to your first segment, and you were talking about topical applications and a buildup causing some types of reactions as time goes by. And then you were talking about the gel applications with the marijuana products. What stops the marijuana products from building up the same way as the other carrier oils or products would be, that you were talking about, that would cause a problem? What's the difference?
I didn't understand. What do you mean?
You were talking about a gel that is you use as an application on people's backs or their hands or their fingers.
Right.
And prior to that, you were talking about topical applications with essential oils causing a reaction within time.
Oh, no.
Yeah,
I think you misunderstood me. What I was saying is essential oils do not necessarily. Sometimes when you put an oil or a product on your skin, you may not be allergic to it the first time. Your body has to build up an exposure to it, and sometimes it combines with other products to give it a recognition so that your body builds an immunity to it. Rarely are you allergic to things off the bat, except for blood products, where you have natural immunity to the other blood products. So if we apply something topical on our skin, there's no guarantee that we won't develop an allergy to it over time. And so what I'm talking about is that we have to have a vehicle to get those products in. Now, essential oils, I don't know a lot about, but they, like Creig was talking to me on the break, he said they've been around since forever, because that's what we used in medieval times, when we didn't have anything else, as healing agents. So there's no guarantee, and with marijuana being a natural product and a natural resin, not everybody's going to have an allergy to it, but some people may develop an allergy to it. And you have to understand is that it's not necessarily the essential oil or the actual chemical that we're allergic to, as much as what it combines with to get it into our skin. It's the combination of the two together creates something that our body can build an immunity to. Does that make sense?
Yes, it does. And I've known about essential oils since the early 90s, when the husband and wife team started developing this product. And I know they used them with aromatherapy too, so they don't have to be used topically. They can be used in an atmospheric type of a condition. But yeah, I just got a little bit confused about, could I have a resistance to a topical use of the marijuana product? Could I have an adverse reaction to that, as you know, if I used another type of application? So you know, it just I understand what you're saying now, though.
Yeah, and with any given product that you use, and I can explain, there are some things that can enhance absorption and some things that can retard absorption, and that could be as easy as skin temperature. I mean, there are, you know, a patient came to me the other day, he was on the fentanyl, he wanted to be on the fentanyl patch, which is a pain patch. Well, he was talking about being in the shower, and he was afraid of doing that because it was going to increase the blood circulation into the skin, was going to increase absorption. So you could be using a topical marijuana on a patient, let's say you have diabetes and your skin circulation is poor. You're going to have a reduced absorption of that product. So you may have to make sure you apply it in areas where your blood supply is good, such as your face or your hands, places like that where you know you're going to get the absorption. We have that problem in certain products like fentanyl, for say. It doesn't work on patients that are thin. It has to have fat to absorb into. So it's a very complex science, and even, you know, Creig was saying, you know, the integument, or our skin, is the largest organ in our body because it covers so much, and it is such a protective barrier that, you know, to get things through our skin, and granted, not a good thing, not everything does, because we would be, you know, it's a kind of semi-permeable membrane. Some oils and certain things can get through. Chemicals, acetones, alcohols, things of that nature that we put on there. So if you have something like a glycerin or something like that, they put on, it feels kind of smooth and silky. Well, some of that will absorb, but some of it won't. So you have to be very, very, you know, careful with when you apply topical agents, and it's a science unto itself. So I hope that explains what, you know, what you're dealing with.
I did miss the very first introduction to your guest. Could you tell me once again?
No, well, this
Creig,
is,
I think you said.
yeah,
And
Dr.
what he
Creig.
does?
Yeah, Dr. Creig Christensen is a chiropractor, and he is my partner in the Independent Wellness Center, which we opened up at 2080 East Calvada, and we're partnering together to bring a more of a. We have this traditional medicine thing of allopathic, prescriptions and things like that, and Creig and I are working towards a more of a wholeness wellness center where we're going to use more physical fitness and improve your mobility and use some of the medicine stuff that I have with some of the natural healing arts that he has, bringing in nutritionists and some other things and trying to make it more of a kind of a smorgasbord, if you could say, of what's out there to help you feel better and get better.
Oh, that's fantastic. Thank you.
You're welcome. So yeah, we're hoping to have a grand opening. We're just we've been open a month now, and we're just kind of going through a lot of growing pains. Creig was working with another office, and we decided to join partners. So he went from busy to real busy, and his wife and her sister. I mean, they were up there till 8 or 10 o'clock at night putting together stuff. I mean, really just putting their sweat into it. You were doing the same thing, and I love doing that because you kind of get that feel of you're doing it yourself. I mean, this isn't anybody else doing it. So my hat's off to you and Anna,
thank you,
and her sister for putting in a lot of effort to make it available for everybody. And you hit the ground running.
Much for your answers and your time.
Yeah, but thank you for calling, Amy. I appreciate it. Good question, and I'm glad you called to clear that up with us. So thank you very, very much. Let's see. The other thing that Ray was talking about was urinary, and a lot of times, urinary tract infections in males are really rare. Okay, I give a male the possibility of having one urinary tract infection in their life. After that, a true urinary tract infection, a true bacterial infection. The second one is an anatomic problem. The second one is usually some kind of bacterial seeding from a gastrointestinal tract, from some maybe fistula, or which is a medical term for a hole between the rectum and the bladder. I guess you could be very, the difference is the urethra in the male obviously being long and the urethra in the female being very short. Doesn't allow bacteria to get up into the bladder. Very hard unless they have a Foley in place or they're incontinent and they have to, catheterize themselves. Then you create a avenue for bacteria to get up into the bladder. Female, on the other hand, has a very short urethra, very easy for bacteria to get up there, so they get a lot of urinary tract infections. Males don't. So a lot of what you were talking about, Ray, seems to be more symptoms associated with urinary and frequency and urgency and prostatic issues, right? Being able to urinate and having that, so you're having that burning sensation of having to force that urine through the prostate. Incontinence sometimes because the bladder becomes so distended as a result of the tightness around the bladder neck that you get the urge to go, it contracts and you leak because it's full. So I really, in those males, you need a full urologic workup in order to get that, and flow dynamics in order to get that worked up. That's the best thing I can tell you with the urine culture. And Louis.
Hey, Doc, how you doing tonight? This is Louis DeCanio.
How you doing, sir?
Louis. Okay, I just got a simple question. What exactly is pink eye, and how do you get rid of it once you get it? Okay, that's my question. Thank you.
Okay, yeah. Well, wrong time of the season for it, but pink eye is usually what they call a conjunctivitis, right? And the conjunctiva is this membrane that starts where the clear part of our eye ends, and it's over the white part of our eye, and it goes all the way and it goes underneath and flips up over down in the groove on our lashes and up and above and stops at our eyelashes. So pink eye can either be bacterial or viral, or it can be contaminated or irritation. And that actually can be viral. Most of them are viral. Some of them are bacterial. But if they're virus, they usually are adenoviruses. Somebody coughs or sneezes, and then they aerosolize the virus, and you get it in your eyes. And then, unfortunately, as it sets up, you can actually get an adenovirus that actually drains down the nasolacrimal duct and sets up an incredible viral infection in the throat and the back of the throat. And we're going to go to break. And Louis, I'm going to take care of that diagnosis and further treatment after the break. Thank you.